Welcome to Parenting with Care, the podcast where we provide insights, tackle some of the most pressing issues affecting our youth today, and provide recommendations to help you navigate the challenges of raising happy and healthy children. I am your host, Dr. Tamir Pielsen. I'm an associate professor, core faculty, and child track coordinator for a doctoral clinical psychology program. I'm an author, clinician, a mother of two, and I've also served as the Child and Adolescent Inpatient Program Clinical Director of one of the nation's largest psychiatric hospitals. In today's episode, we will be discussing a critical and sensitive topic, pediatric suicide, with a particular focus on the rising suicide rates among Black youth. Suicide is a leading cause of death among young people, and recent studies have shown alarming increases in suicide rates among Black children and teenagers. Today, we'll explore the statistics and underlying factors, and most importantly, provide guidance for parents and caregivers on how to support their children. So let's get started. To understand the gravity of this issue, let's start with some statistics. According to the Centers for Disease Control and Prevention, the CDC, suicide rates among Black youth have been steadily rising over the past decade. In an article posted by Pew, federal data showed that the suicide rate among Black youth ages 10 to 19 surpassed their white peers for the first time in 2022. Increasing by 54% since 2018, and from 2007 to 2020, the suicide rate rose 144% among 10 to 17-year-olds who are Black. The National Action Alliance for Suicide Prevention in 2020 published a report highlighting the mental health trends among Black youth. They urged our government to create policies that would address the crisis in the Black community. In a report to Congress from the Congressional Black Caucus, the emergency task force tasked with addressing youth suicide and mental health, it was found that self-reported suicide attempts have increased by 73% for Black male and female adolescents over the past 25 years. So these numbers are staggering and highlight a public health crisis that truly requires immediate attention. So you must be wondering, you probably are wondering, what are the underlying factors contributing to this increase? There are several factors that truly contribute, unfortunately, to the rising suicide rates among Black youth. These include racial discrimination and trauma, socioeconomic factors, mental health stigma, exposure to violence, and lack of access to healthcare, to name a few. So let's take a look at the racial discrimination and trauma. Young people experience racism. They also experience racial trauma that truly can impact significantly their mental health. This is whether it's in the classroom, where unfortunately peers may say things and act in ways that affect that child's well-being and how they view themselves, or to the adults that they interact with in different sectors, whether it's in the community, at school, that may make them feel as if they're less than just because of the color of their skin. When we look at the economics, many Black families face economic hardships, and that in and of itself can contribute to stress and mental health issues in children. Now, for those saying, well, Dr. P, I am middle class. I am not living paycheck to paycheck. And this is still an issue. Yes, it is multi-layered and unfortunately multifaceted. So it may not necessarily be a financial factor for one family, but it could be a racial discrimination or exposure to violence or lack of appropriate healthcare nutrition for another family. Poverty, lack of access to quality education, and living in unsafe neighborhoods can play a role. In addition to the unsafe neighborhoods, so I mentioned exposure to violence, there are higher rates of exposure to violence for our young youth, Black youth. At times, it's not even in the community that they live in. It could be through the exposure through media, as well as what we call vicarious trauma. So these are young people listening to the stories of others, whether it's a friend who witnessed a heinous act, or adults in their lives talking about acts of violence towards others or what they witnessed. That child is listening. That information has an impact on them in not the most positive ways, especially if they have little to no skills, coping skills that are healthy to help them really cope with what they've heard. This brings me to mental health stigma. Within the Black community, there is often a stigma surrounding mental health issues and seeking help. This can truly prevent young people from getting the support and the treatment they need. And within the Black community, we're also talking about stigma within the church. The reality is that you can pray and go to counseling. You can pray and follow the recommendations of your child's pediatrician if they're in need of psychiatric medications. But too many, because of the stigma that, maybe you're not Christian enough, you're not praying hard enough, you are paying for the sins that you unfortunately took part in when you were in your youth. And that's why your child is behaving in the way that they're behaving now. That's why your child has these mental health issues. I mean, the unfortunate negative things that people will say to families who have children in need of mental health treatment. Oh my goodness, there are countless things, unfortunate things. And so the reality is we need to address the mental health stigma, not only within the home, but in community. That includes the church. We also see lack of access to mental health care. Black youth often face barriers accessing mental health services, including a shortage of culturally competent providers, as well as the financial constraints that come along with it. It's important that when you do seek support for your young person, is that they are working with a clinician who is willing to listen to understand and not come with biases and preconceived notions that, for example, all Black kids experience the same issues. So, what are some recommendations that I can provide to you? Understanding the factors is crucial, but what's equally as important is to know how to support our children if we suspect that they're suicidal. So here's some recommendations for parents as well as caregivers. You want to maintain an open line of communication. Create an environment where your child feels safe to express their feelings. Regularly check in with them about their emotional well-being. I know that in our community, oftentimes we hear that, I am not your friend. I'm not one of your little friends. The reality is we can be friends with our children and create clear boundaries as parents so they know what is appropriate interaction with their parent and what is inappropriate. We need for them to experience trust, for them to hear that we will be available to them and we will provide them with unconditional love, and that what they're struggling with does not define who they are. So to do so, we really do have to create an environment where our children feel safe. You want to also educate yourself and your child. Learn about the signs of depression, which was in episode 1, and suicidal ideation. Educate your child about mental health and the importance of seeking help when they need it so that it's not too late. In my doctoral training years ago, one of the opportunities I was fortunate enough to have was to work in the STAR Clinic, the Services for Teens at Risk for Suicide. That clinic is one of the nation's first and most comprehensive clinic that addresses suicide in youth. And I can count on more than one hand how many parents did not know that their child had either attempted suicide, had contemplated suicide, or had an attempt that led them into the hospital. When they would sit and talk to us about that, many of them did not even suspect there was anything wrong with their child, because these children were high-performing children. They were on the sports team. They were athletes and musicians. They were dancers. These kids were typical kids, and many of them also high-achieving kids, and their parents had no idea. So you want to educate your child. You want to educate yourself and learn the signs of depression and what suicidal ideation is. You also want to seek professional help. If you suspect that your child is struggling, don't hesitate to seek professional help. Look for mental health professionals who have experience working with Black youth and understand the unique challenges that they face. Clinics such as the STAR, Services for Teens at Risk Center, which I mentioned earlier, host and provide resources from clinical treatment and training, annual conferences for individuals seeking guidance on how best to help our young people. You also want to build a support network. Ensure that your child has a strong support system. That support system includes family, yourself, friends, and mentors. Encourage involvement in community activities that really foster a sense of belonging. So that could be the local YMCA, gym, taking part in sports in the community, a whole host of ways to really engage them outside of the home. You also want to address bullying and discrimination. Advocate for your child in school and other settings to ensure that they're not subjected to bullying or discrimination. Teach them how to cope and report any incidents of abuse, discrimination, or bullying. The last 2 points really are points that address your role as parent, guardian, supports for your young person. You want to monitor social media and media consumption. Be aware of your child's social media activity and the content that they're exposed to. So if they're of a certain age, I'm not going to just add a number, but a certain age where, honestly, you ought to be monitoring their account and having access to what they post regularly. You want to discuss the impact of media and help them navigate negative influences. I have a couple of students who are working on the impact of social media and media consumption as it relates to pediatric eating disorders and some other conditions. So it's really important for us to take care of our children by also monitoring what they watch, what they consume via media. You also want to promote healthy lifestyle choices. Encourage physical activity, healthy eating, getting enough sleep. So like with babies, when you bring a newborn home for the first year or so of their lives, you have a routine for them. They know that even though they can't tell time, but when they're getting that warm bath, they're getting a warm milk, they're lathered in some lotion or some calming balm that you put on them, it triggers in their brain the signs and signal that it's time for bed. Continue some kind of process with your young person. Create a healthy sleep hygiene for them. We know that all of these can have a positive impact on mental health. So, as we've discussed today, pediatric suicide, particularly among Black youth, it's a deeply concerning issue. We can make the difference by understanding the factors at play and taking proactive steps to support our children. If you or someone you know is struggling with thoughts of suicide, please seek help immediately. The National Suicide Prevention Lifeline is available 24/7 at 1-800-273-TALK, as well as the National Suicide and Crisis Lifeline at 988, where you can call, text, and chat with trained staff 24/7. Thank you for joining us today on Parenting with Care. Remember, together we can support our youth and build a healthier and more resilient community. If you found this episode helpful, please share it with other parents and caregivers. For more resources and information, visit our website at www.serenityforyouithandfamilies.com. Until next time, take care of yourselves and your loved ones. This has been Parenting with Care with Dr. P. Subscribe to our podcast or on YouTube for more episodes and parenting tips on mental health. Until next time.